Since becoming employed at my facility, I've noticed a few staff procedures that just seem to lack consistency. One particular area where this inconsistency is evident is staff awareness of proper PICC line care and maintenance. There are a few ways that I feel this process can be streamlined to benefit the staff and, most of all, the patient. One way is through education. Education is key in this profession that consists of constant change. Thus, adequate training of both staff and the patient should improve maintenance and care of the PICC line. One of the elements that makes PICC line care a problem is an influx of new staff that haven't had the proper education or hands-on training with PICC line management and care. Even more seasoned nurses have become too relaxed in this area and need a refresher course. This could be considered a human factor that creates a barrier to evidence-based practice. The lack of knowledge or skill creates a barrier in caring for our patients effectively. The facility I work for is small in nature and hasn't seen much in the way of PICC line usage in the past. With many changes to our facility, including expansion, PICC lines are becoming prevalent with cancer patients and the increased usage for patients being sent home on outpatient antibiotic treatments. Proper education can alleviate the potentially uncomfortable situation with PICC lines usage from the patient or even death of the patient. PICC line care issue was brought to everyone's attention on my floor when a patient's line was found without an adapter attached and was left open to air. This mistake could lead to the patient developing an air embolism and death. We recognized that we had a problem. Competency training for new and seasoned nurses had to be created. This solution made the nurses more vigilant in their assessments to check those PICC lines. As a quality improvement project for the hospital, I helped organize the competency training and also assisted in its delivery. New staff welcomed the education and training with open arms. However, I did feel some resistance from a few of the seasoned nurses, but in time, that too changed. I also implemented a quality control effort during handoff report for the nurses to check the PICC lines together. Team meetings were held before every shift with the oncoming staff to update them on the changes, new information, or just the ins and outs of the shifts. I did education segments during those team meetings on the PICC line training that was held just to keep the new information on PICC line checks fresh during their handoff report. I did this segment for a few months after the competency training to help with the new implementation. This education and training becomes a strategy for overcoming barriers by improving building and strengthening the knowledge about evidence-based practice. Patient safety is a constant reminder. Part of our goal is to keep our patients comfortable and satisfied with their care. Due to the nursing shortage, our patient load can be large, and it seems that there is no way to give the great care for which we strive. These are the times when new nurses leave their shift feeling defeated. These are also times when new and even seasoned nurses are more likely to make mistakes or miss the little things that can cause big problems, like adapters on PICC lines. Human error is always a possibility regardless of the training. However, the purpose of the study is to ensure that proper care and maintenance of patients' PICC lines is sustainable over time after training. In order to ensure proper care and maintenance of PICC lines, reading and research is required to be well informed. A peripherally inserted central catheter, also called a PICC line, is a long flexible tube that is inserted into a patient's peripheral site and extends to the distal superior vena cava. This insertion is then checked with a chest x-ray for proper placement. This line is used to help carry nutrients to the body or to administer medication and blood. But blood draws are also done at the site for patients whose veins are not usable veins. PICC lines should be cared for carefully and in an educated manner. An article from the Cleveland Clinic stresses that many complications can happen with the PICC line after placement, including an air embolism. Therefore, proper care of the PICC line is essential for the patient's safety and recovery. Peripherally inserted central catheters have become more common today due to the extensive use of antibiotics that can be irritating to veins or in cancer patients receiving chemotherapy weekly, if not daily. Having a central line saves the patient from having evasive vena punctures several times a day or week. As noted in an article by Furstenberg, Lee, and Hughes in the International Journal of Critical Illness and Injury Science, complications from improper care of PICC lines can increase healthcare costs, extend hospital stays because of infections, and possible death from an air embolism, just to name a few of them. An air embolism can be caused by the line not having an adapter or hub attached to the end of it, therefore leaving it open to air. PICC lines have relatively low complications rates, but an air embolism is considered one of the top 10 serious issues. According to Bose, Geddes, and Nichols in an article in Medscape, some signs to remember when suspecting an air embolism are hypotension, lightheadedness, confusion, tachycardia, anxiety, chest pain, and shortness of breath. Proper care and maintenance of the PICC line can help avoid or catch the missing adapter on the end of all PICC line lumens. Due to our nursing shortage, it is easy to get overwhelmed with the workload and overlook these things. Something that seems so small can become a huge issue. In American Nurse Today, it cautions that air embolisms can be caused during catheter insertion, maintenance of the line, or during the removal process. Air can enter the patient through loose caps, certain types of locks or clasps, and syringes. All caps, clasps, and locks needs to be inspected and applied properly and secured tightly to the central line. Earhart further states that proper patient positioning during the removal process can help prevent the air embolism. Even proper application of the dressing on the catheter insertion site can help prevent air embolisms. An occlusive dressing should be used to help seal the site as part of the dressing after initial insertion and as part of every dressing change. To reiterate, when caring for PICC lines, education is the key to success. Not only do the doctors, nurses, and PCAs need to be educated, but the patient and the family need to be educated as well. In an article titled Care of Your Central Venous Catheter, it was noted that patients need to know the signs to look for in case of an infection or possible air embolism. The patient and family need to know what to do in case of an emergency. The article further states that patients need to be aware of the proper dressing change technique if, by chance, they are faced with having to change the dressing themselves for some reason. Patients should either be given a dressing change supply or told where to get it. The article sums it up nicely. An informed patient is a proactive patient. Given the research, one can assume that if PICC lines work properly, patients will experience less discomfort from medication administration, blood infusions, or even blood draws. This will turn a rather uncomfortable experience into a manageable experience for the patient. Again, if this is to occur, proper training is vital. The management and staff attended an in-service training conducted by our hospital PICC line nurse on the proper way to clean and change dressings and what to look for as far as insertion length and numbers. We were also shown what to look for in case the line has been pulled out. Also, there were teaching of proper technique to remove the PICC line and what to look for. The training ended with all staff being educated on how to make sure all PICC and port ends are close to air, which was our specific issue and primary cause of the in-service training. There are different hubs or adapters to use on the ends of the lumens to close them off to air. Our mission then was to educate the nurses and aides working closely with the patients with PICC lines. When trying to figure out how we could spread the word and educate the nurses on our units about the proper PICC line care and leaving the lumens open to air,